Hey, Dr. C here with you. So should you take thyroid medication? This is a really big decision, and it's something that people struggle with. They're often led to think that this will be the answer for them. And the truth is that so many people have thyroid symptoms. So many have struggled a long time to get diagnosed, and they're eager to feel better. And often when they reach that diagnosis, they just want some solutions. They want some answers. And there's misunderstandings in how thyroid disease causes symptoms in most cases. The popular belief is that there's simply a lack of hormone, that the body needs something and it's not there, like your car's out of gas. And if that were true, it's so easy to think that, oh, we'll just put more gas in the tank. All will be well. Let's give medication that has these hormones. The lack of these hormones is the problem. What we're now learning is that that's true, but that's exceptional. Those are unusual cases. In nearly all cases, the symptoms are not caused by a lack of hormone. They're caused by an autoimmune response, or they're caused by not using these hormones properly. And because it's not a lack of hormone, that's why just adding more hormone on top of things rarely helps. We now have large studies showing that that's quite typically the case. So, should you be on thyroid meds? If you're offered to start them, should you start them? If you're already on them, what should you do? How do you know what applies to you and how do you know what doesn't? For starters, we got to define some terms. So we've got a common understanding here. So I'm going to talk about levels of hypothyroidism first, and then we'll talk about how people are told whether they need meds or not, and which categories do and which ones don't. So the mildest versions of low thyroid function are called suboptimal thyroid function. And this is to where all your lab levels are normal, but there can be an argument made that they're not optimal, meaning that they could be better. Healthy people show better numbers. And this can be true. There are ways in which these levels can cause symptoms. But that doesn't mean that these are situations that benefit from medication. So we talk about normal and optimal in respect to the TSH, the T3, and the T4. And the TSH, there's good data saying that healthy people have a low normal TSH. They tend to run between somewhere like 0.4 and 2 with variation. And there's also data saying that those who need medication sometimes feel better when their TSH is down in that low end of the range. Those are both true points. But it's not true that everyone has to have their TSH low normal. And it's not true that everyone without a low normal TSH needs or will benefit from medication. That one doesn't follow. The next thing you'll hear about is optimal levels of T3 and T4. There's a popular argument that these hormones need to be on the high side of normal. And with the assumption that the TSH and the T3 and T4 are opposite one another, you could think that, if the TSH is better low, those should be better high. And that would be a logical assumption, but evidence doesn't pan that out. So the inverse relationship between a TSH and the free hormones, the T3 and T4, is only true at the extremes, when you've got way too much or way too little. But between those severe extremes, there's not a clear inverse relationship. What that means is that healthy people, their T3 and T4 can be all over the place, and that's totally normal and it's totally fine. And there's even data showing that those who consistently have high T3 and high T4 aren't the healthiest of people. So that's one that is not a good reason to go on thyroid medication. But it's a common thing we see. So many people that have normal levels but a high normal TSH, say 2.5 or 3, they're told, oh, this means you need medication, or this means you might benefit from medication. And many people who have normal T3 or T4, but they're on the low side of normal, are told, oh, these should be high, this means you need medication, or you'll benefit from it. Yeah, no. It's been looked at in large groups, and people don't benefit in those cases. The next version of hypothyroidism, the next degree of it, is called subclinical. So before we were talking about splitting hairs with inside the normal range. Now we're going outside the normal range. Now the TSH is elevated. So most ranges say that it's normal up to 4.5. With subclinical disease, it's higher than that. It could be as high as 10 or 20. But the T4 is not way below range. The T4 is somewhere in range. It could be on the bottom end of it, but it's in range. And this is called subclinical hypothyroidism. Now, this is where most adults in the conventional medical circles are identified as having thyroid disease and put on medication. Yet we have big data sets showing that people don't benefit here. The medication does not consistently lower symptoms. It doesn't lower health risks. It doesn't cut the risk of progressing to other versions of thyroid disease. And it doesn't even improve total risk for mortality. In fact, it worsens it. So thyroid medications don't help subclinical disease. And let's think about this. The suboptimal version, that's where most people in the functional natural medicine world get put on thyroid meds. And if there's clear data that the meds don't help when it's at step 2, they certainly don't help at step 1. Now, interesting point, there's a lot of folks who have gone on meds at step 1 or step 2, and they've done better. So what the heck is up with that, Dr. C? Well, here's the thing, you guys. So in almost all cases, people do more than one thing at a time, especially in natural medicine. My peers, they don't say, just take a medicine and go away. They give good recommendations for diet, for lifestyle, sometimes nutraceuticals. But here's the thing, that stuff does more than you would think. And if someone does many approaches, you can't say, oh, the medicine must have been the part that helped. Why would we think that? So when the studies are done, they will look at one variable. And when medicine's the only variable, it doesn't help. So we know that when it does, and someone does a lot of stuff, the other stuff was the bigger player. It was the part that made more of a difference than the medication did. Okay, so that was like suboptimal, subclinical, like step 1 and step 2 of hypo. Now there's step 3 of hypo. This is overt hypothyroidism. This is where the TSH is really high, often over 20. T4 is way below range. Medication's totally a reasonable option. Now here's the thing, it's not the only option. Some of the studies on the thyroid reset diet were done on those with overt hypothyroidism. Many people did better from it as well. So medications can help, but they're not the only thing that can. The next category we have is those who lack a thyroid. They had a total thyroidectomy. Now this one's quite simple. They need medication and they will benefit from that. So wrap up for these categories: suboptimal, the mildest form, meds don't help. Subclinical, step 2, meds don't help. Overt, step 3, meds might help, they're not the only option. And then no thyroid, step 4, medications help. That's who benefits, who doesn't. So what are the other reasons people are offered thyroid medication? Well, there's some scenarios, barring those, in which meds might help. So one of which is post-thyroid cancer. There are times to where it does take tighter control of TSH scores to cut the risk of recurrence. So that's one category where meds might help that isn't quite as far along as stages 3 or 4. The next one would be subclinical hypothyroidism with infertility. There is data saying that controlling thyroid levels may help fertility, even if there's not other indications for doing so. Now, it doesn't mean that that person needs to stay on meds afterward, but during that time, there can be a case made for that. But barring those situations, it's pretty much lacking a thyroid or overt hypothyroidism. But there's many other reasons that doctors may offer thyroid medication. A big one is autoimmunity. So if someone has clear signs of Hashimoto's, they're often told, this means you need medication. This means medication will help you. No, it doesn't. No, medications don't help symptoms from autoimmunity. Now, if someone needs medication, some types of medications are more suitable than others given their autoimmunity. But medications alone, or even with other things, they're not helpful adjuncts for treating the autoimmune thyroid disease. And I've even seen sometimes people have positive ANA scores, which is another autoimmune test that doesn't relate to the thyroid. Thyroid meds do not help that. Sometimes medications are offered to help with symptoms. Now here's the thing, the person doing this, they want to help, they mean well, they want these symptoms to go away. They see someone that can't lose weight, that they're just wiped out. Maybe their hair has been thinning, brain fog, they got dry skin. And because these can be symptoms of severe hypothyroidism, it's not crazy town to think that maybe thyroid meds could help. except for now we know that they don't. Not only do they not help, but when they're not needed, they can worsen all these problems. They can make you gain weight even easier. And sometimes when your levels are showing you're getting too much, they still do that. Sometimes even when your levels are normal or optimized, they still do that. They can still worsen these classic symptoms. Now, there's a few other ways in which certain tests might cause a practitioner to think that a person needs medication. Say they've got a low body temperature, or they've got a delayed Achilles tendon reflex, or they've got certain gene abnormalities. Sometimes practitioners will say, oh, you need medication because of this thing. No, no, it's again, lacking a thyroid, overt hypothyroidism, or those few other cases. These are things that are real. These are things that can affect your health. They might be relevant in some way, but thyroid meds do not help. So what do you do if you're having these symptoms and you've got these abnormal levels? How do you go about helping them out? Because you want to do your best. First step is getting your iodine in a healthy range. The window of thyroid recovery is getting your iodine somewhere below 100 micrograms per day. The thyroid reset diet guides you through this. Step 2 is being on helpful nutraceuticals. Thyroidspecificformulations.com has a quiz that will help guide you to which ones are best. The foundational step is the Daily Reset Bundle, which is the Thyroid Daily and Omega Pure and Calcium Magnesium. Thyroid Daily is a 1-a-day micronutrient support for all versions of thyroid disease. Omega Pure is anti-inflammatory omega-3 fats, and it's low in iodine. Most fish oil is not. Calcium and magnesium are important macronutrients needed for your bones, for thyroid hormone metabolism, and they're in a form that won't cause you to have a problem with the production of thyroid hormones, like some versions of calcium can. So that's the foundation. The third step is to really identify and treat any comorbidities. There's a whole lot of diseases that fly under the radar along with thyroid disease. Here's like the top 5. One is latent iron depletion. So normal iron, but below ideal. It's real. And with thyroid disease, it causes a lot of symptoms, especially those associated with fatigue and hair loss. Number 2 is HPA abnormalities, formerly known as adrenal fatigue. Yeah, stress to the adrenal axis. A real thing, a big driver of symptoms, common with thyroid disease. Number 3 could be calcium disorders, hypocalcemia, hypercalcemia, both very common, both big factors in many symptoms. Joint pain, IBS, also hair loss, mood changes. Number 4 is fatty liver. Very common, extremely common in all populations. Big driver of chronic pain, poor digestion, weight loss resistance, and others. Number 5 is sleep apnea. Big driver in fatigue, also in unstable blood sugar, brain fog, you name it. So these are just a few, but there's many things like this that go along with thyroid disease. And in many cases, they're the real culprits for symptoms, but they're not identified and taken care of. All right, Dr. C here with you. Now you know what are the earliest signs of thyroid disease. You know how to, if you need medication or not, and if you don't, what to do about it. And the most important message is that you've got things you can do that can help. Your thyroid can get better. Your thyroid can work well on its own in most cases. And medications are often not the answer. In some cases they are. All right, more to come real soon. Bye-bye.